Well, as we age, we all know things change, including our mind. Do you ever walk into a room and then you forget why you're there? I do that all the time. Does that concern you? Could it be a sign of more or worse things to come? Dr. Lauren Maxim is the Market Medical Director of ArchWell Health, and she's here to help us better understand memory lapse or memory loss and when you should be concerned. It's good to have you here.
Thank you for having me.
Ooh, hot topic.
Yes.
Hot topic. I walk into a room all the time, forget why I'm there. So how can you know if when that happens, if that's just a normal part of life, or if it's something we do need to be worried about?
Sure, it can be really difficult because just like the rest of our body, our brain changes as we get older. So some things to watch out for would be when it's really impacting your ability to do your daily tasks. You're becoming more forgetful. Maybe you used to be really great at balancing your checkbook and now you find it more difficult. Some people may notice changes in personality, sometimes forgetting words, things like that. Could be signs of something more serious going on.
If you put your keys in the refrigerator, things like that.
Yeah,
not that I've ever done that. All right, can you explain very quickly? We talk about dementia, we talk about Alzheimer's. What is the difference?
Dementia is a term that we use in medicine to just describe memory loss.
Okay, and that's kind of the overall blanket.
Right, it's kind of an umbrella overall, different types of dementia. There are different things that can cause dementia. Alzheimer's is one type of dementia, so Alzheimer's is a more specific type of memory loss.
Okay, so when it comes to dementia then, there are some common signs maybe you might see in some of your patients. What might those be?
So a lot of times the concerns are brought forward from maybe family members who notice some of the things we talked about already, that patients might have used to be really sharp at board games or puzzles or balancing the checkbook, and they're struggling more with doing those things. Becoming more forgetful. Sometimes these memory changes can cause frustration in a person, and so family members may notice personality changes, or maybe a person is getting more grouchy or frustrated than they used to. So those concerns are brought forward. It's important to talk to your primary care doctor about those things.
Yeah, and then once we do that, then what happens next?
Right, so it can really depend, right? At ArchWell, we always screen for memory changes at least once a year because it can be really hard sometimes for patients to admit that maybe they are experiencing those things. So sometimes just by doing a simple screening, it can invite a patient to really open up about things that they're noticing. And then just having that conversation with your primary care doctor can allow them to decide, is this something that I'm a little concerned about, or, is that something that maybe we just need to watch and keep an eye on? Okay,
I'm going to ask you a question here. It's a big one, and you'll have to answer it quickly. But so if we notice that in someone that we're with all the time, that we care about, how do we address that? I mean, what do we do?
It can be really complicated. It's important to keep open communication with your loved one, and also open communication with the primary care doctor of your loved one, so that they can help facilitate any workup or anything that may need to happen to care for that person. And it's also important to talk to the person about their wishes and come up with a care plan, because as we know, dementia and memory loss can progress. And so you want to make sure that you have those hard conversations early on. And that's why, building that good relationship with your primary care doctor, getting that extra time with them like we do at ArchWell, and even maybe engaging the help of a social worker who might be able to connect you to community resources can be really helpful.
It sounds like it's better to do that sooner rather than later, right? If you have any concerns, and maybe even going to an appointment with a loved one just to kind of, express your concerns. Wow, really good information. I really appreciate that. Thank you so much for being here. We appreciate you. All right. If you'd like more information, ArchWell Health has an office in Apache Junction. You can call 480-906-4204 or find one in the valley close to you, archwellhealth.com.